You're listening to the NASM CPT podcast with Rick Richey, the official podcast of the National Academy of Sports Medicine.
Welcome to the NASM CPT podcast. My name is Rick Richey, and today we're going to talk with a professional who knows a little bit about how to get trainers or individuals in general to work on adherence and compliance. And there's carryover between what I believe that she does and what we do as personal trainers and fitness professionals. And from what I understand, she helps people medically try to maintain that focus, but there's a lot of carryover, and the research is it seems to have something to do with how people work with adherence and compliance to exercise, and I think personal trainers can really benefit from this conversation. So I want to introduce everyone to Antoinette Schoenthaler. Hi, Annette. Thank you for being with us today.
Hi, Rick. Good afternoon, everyone. It's a pleasure to be here today.
It's an absolute pleasure. Thank you. And I'm excited because, as I mentioned to you earlier, that my focus of study in school was attribution theory and attributional retraining. So that has a lot to do with getting people motivated and reattributing what it is they blame things that they can't do, and how do we move forward with that? So do us this, like run down a little bit about your education, where you work, and what it is that you currently do, and then we'll start to peel this apart.
Yeah, sure. So I have a doctorate of health education from Columbia University. I currently am the associate professor of population health and medicine at NYU School of Medicine. And as you said, my research focuses on adherence behavior. So why do people stick to behaviors, things like taking their medications or exercising, healthy eating, things like that? And what can we do to support people or patients to do those behaviors for the long term? And you're right, things like motivation is a key factor that plays into that.
No, I've heard people say this before, and I want to get your opinion on this. I've heard people say motivation isn't real. It's not real. It's about just committing and making a decision. What do you say to that?
Yeah, I mean, that's kind of a fallacy. That's saying that if we just had enough willpower and self-control, we'd be able to do everything. But we know that in times of stress that's limited, right? Particularly if we have to make a lot of decisions or do a lot of things and we're tired and we're stretched out at the end of the day, that's just not enough. There's other behaviors like your level of confidence and the amount of support you have that are going to keep us going.
And one of the things that I know that doesn't actually work when we're talking about exercise, but when it comes to medication, I'm supposed to take medication twice a day. And before I got my little Monday, Tuesday, Wednesday, like pill box, before that happened, I didn't know if I took my medication or not. And because every day is just like the next one. And so what I would do is I would err, I guess, on the side of caution that says I would probably rather not take medication than take too much. That's how exercise is done. People, nobody knows, that never comes up where they say, I don't know if I exercised today. And usually they err on the side of not exercising. So how do we get people in turn to start shifting it and say, I need to, one, adhere to something. And so the adherence is showing up. Compliance is the program. So for us, it's the program. It's what maybe did the personal trainer write out for you guys, and what it is that you seem to do. It's really like, what is the medication? Are you complying with the medication? So with adherence, I think is really what we're trying to stick with right now. What does it? What is it? What is this adherence? What is the motivation to do so? Kind of give us a spin around the block with this.
Well, first thing is there's no magic bullet. I have to say that, we've been doing this. We do this research for years, and there's no secret sauce or, it's a combination of things. But I think paramount, it's got to be personally important to that person. You talk about motivation, it has to be intrinsically what we say motivated. It has to come from within that person. It can't be an external force pushing the person out the door, pushing the person to get there, because if it's not tied to what's important to them or what their values are, they're never going to commit to it long term. You'll see that kind of New Year's resolution type increase in physical activity that then just decreases because it's not tied to what's important to them. So that's kind of the first thing. The second thing is it has to become a habit. We hear a lot about habit formation and routine. So with like taking your medication. So, your pill box is one form of habits formation that it's in there. It's a good reminder. Putting it next to your toothbrush and doing it right after you brush your teeth, for example. You can think of a corollary with physical activity, putting your running sneakers at the front door, putting your gym clothes on in the morning before getting dressed, for example, on the weekends, things like that build those habits so that they're detracting from the excuses and, again, the decisions you need to make so that it happens.
I think one of the things that I talk about probably more than anything is in this kind of attribution theory is that first of all, nobody wants to hear that. Nobody knows what that means. And so what I do in many of the conferences I speak at, it's the session is entitled Blame. And it's about what people blame to be their reason why they can or cannot do something. And then what we do is we look at those blames and we try to reattribute that and say, okay, well, is this something that's always going to be this way? So for instance, if I have, let's say a lady that just had a child and she says, they don't have daycare, they don't have this, I'm very tired. We know that child is going to grow up, right? So it's not always going to be like that. The child's not always going to be 6 months old and will be able to maybe go into the gym, daycare, things like that. So there are things that change, but there are also things that are out of people's control in many instances. And we like to say things like, do what you can, not what you can't. And there are a lot of people that only see what they can't do and focus on that. So how do you shift mindset with it?
Again, it has to be based on their value system. So as someone who has a 3-month-old, I can understand the tire trap, but exercise is a priority to me. It's very important for me to be a good role model to my kids. I have a 7-year-old daughter, and so her seeing me run every morning is important. And so again, it's tying to what's important in that person's life and having it become a priority and thinking through the day. We often have to think when we think abstractly and we say, oh, my day is too busy. That's too abstract. We need to get more concrete. Well, what's going on in your day? What are those slices of time? And again, like for me, it's a personal value and I tie it to my kids. And that's why exercise fits in my life, even though I have a 3-month-old. So again, it has to come from within that person. If it doesn't come from within that person, and it's not based on what they want and what's important to them, it's not going to happen, particularly for the long term.
So Annette, I have several businesses, and some of the interesting things that'll happen is that there'll be incidences that come up. And we have to make real serious decisions based on an incident. And it's important to us as a business that we identify our values. Right? And you hear things like mission, vision, and values, and it just sounds like a bunch of corporate malarkey. But when we look at our values, that helps us better make decisions for us as a company. And so we had something that I spoke with our operations manager just the other day, and it was an issue. And I said, we have to go back to our values. Let's go back to our values. Even if we lose business, we need to stick with our values. Now, with that said, that's something that we've done and developed and written out and committed to. Do you ever have people do that individually, like write it out, task it, make sure you're living your life by it? Or you just say, you have values and go with it? Do you try to cement it?
No, we do cement it. So there's 2 techniques. One is motivational interviewing. It's a counseling technique that we really adhere to in behavior change theory. And it's got a values exercise where you list your 3 values, why they're important, and how your behaviors can align with those values. There's another simple technique called implementation intention from the social cognitive literature. And it's making just a very simple if-then plan. And this really helps get through those bumps in the road that you're talking about. So like, if this happens, then I will do this, right? If I'm feeling, if it's 8:00 at night and I want to veg on the couch, then I'll do this instead. And it's really these simplistic if-then plans. And then if you just say it 3 times, write it down 3 times and then memorize it, it really then becomes ingrained. And it's a really great way to get people over these humps to kind of maintain their values. And you can attach a reward to it as well as a way to say, I've done my plan, I'm on track.
Oh, interesting. Okay, so I want to talk about the rewards, but I also,
Mm-hmm.
it made me smile when you said say it out loud 3 times, and I was like,
Yeah.
oh man, it's like Beetlejuice is going to pop up. But if we say it and we write it down, I think that's
Yeah.
where a lot of value comes in that people sometimes seem to dismiss a little bit, which is writing down goals. And I know even when it came to studying, it wasn't until I was in grad school where I had heard for years, write notes, take notes, rewrite your notes.
Mm-hmm.
And I was like, not happening. And then when I did it, I was like, oh my gosh, this makes everything so much easier.
Mm-hmm.
It directs your mind in a way that saying it or repeating it internally just does not do. So I'd like to reinforce with our audience the writing things down. So now when it comes to doing what you do with those value systems, like the if-thens, we talk about giving a reward.
Mm-hmm.
I'm curious because, I'm curious if rewards are a good thing or if rewards can lead people down a path that is not so good.
Yeah. No, again, so you're right. You have to be very careful about what the reward is. The reward should not, for example, be food-based or something that's going to detract you from your ultimate goal. They really should feed into the intrinsic motivation you're trying to build, not be something that's extrinsically motivated. So the idea of just feeling better about yourself internally, thinking about what the endorphins after a run, what are those types of kind of more intrinsically motivated rewards that are going to fuel the behavior, rather than saying, stopping for an ice cream sundae on Sunday, which has its pros. But if we're thinking about long-term behavior change, we need to think about what those things are that are going to drive the behavior for the long term.
And do you think that these are slow incremental changes, or do you believe that in many cases you just have to try to cold turkey something and say, don't do this, or you've got to commit to this?
Well, it depends on the individual.
Okay,
Sometimes,
good. I like that you said that.
Yeah, it totally does. And there's even been some studies saying smoking, where say men do better with cold turkey than women do. Women need a lot more building of their self-efficacy or their confidence, whereas men feel confident already, and so they're easier to do with the cold turkey. I'm a big proponent of SMART goal setting. I don't know if you've talked about that, but the idea of having So SMART goal setting are specific, measurable, achievable, relevant, and timely goals. Again, writing the goal down. And the key thing about goal setting is a lot of people set New Year's resolution type goals. I'm going to lose weight. I want to run 3 times a week, but that's just not good enough to see behavior change. It needs to be something like, I'm going to run 1 mile on Monday, Wednesday, and Friday at 4 p.m. For a month, and tracking that very specific goal that's people feel that are achievable in order to see behavior change. So like you said, very specific.
And the specific part is really important. I think that's it kind of goes back to that statement where our clients might say, when you say, what do you want? What are your goals? And they say, I want to lose weight. And that is really vague. It is really vague. So we say, well, what does that mean to you? But we also want to get a little bit deeper too, right? Like, is it a fat loss that we're looking for? Is it body composition change, not just weight loss? So there are many layers to it.
Right.
But really what I want to kind of dig into right now, because we've mentioned it multiple times already since we've been talking, which are the phrases or the words intrinsic and extrinsic. If you could take a moment and just break that down and let's discuss it. And, for people who know what it is, it's good to hear it again.
Sure.
And for people who don't know, it'll be nice to understand it better.
Yeah, absolutely. So the easiest way to think about it is intrinsic means internal or in ourselves. It's those motivations or goals that come from our value system. We decide they're important. They're more likely to be linked to long-term behavior change as opposed to extrinsic or external motivators. That is oftentimes people telling us what to do. So the doctor telling you to lose weight, your counselor or your nutritionist telling you have to eat better. Those things might prompt behavior change, but it's only for the short term. It really needs to come from within ourselves. That's why intrinsic, in order to kind of be long term.
And do you find that SMART goals? Actually, let me rephrase. Extrinsic is going to be there because we don't control those. Other people put them on us. How do we get people to develop a stronger sense of intrinsic value and what it is that they would, should, need to do?
Yeah. Well, first, it's giving people the opportunity to say, like, why are you here? Like, what, like you said, is it body composition? What are you trying to achieve? And not just about, exercise, I want to be stronger, but, is this for some kind of long-term health goal? Or do you want to live longer? Do you want a better quality of life? Like, what is driving this new interest or continued interest in being physically active? And having people really articulate that and talking about what their values are. Oftentimes we cut to the end, we cut to the, losing the weight part or getting stronger without kind of that process of why.
Oh, man, that's for sure. I tell people all the time, Antoinette, I want to be able to play guitar. I don't want to practice it. I don't want to learn anything about it. I would just love to be able to grab a guitar and play it. That sounds amazing. And what people do is they do in that situation and many others focus on the outcome, the grand finale, what I wish, what I want, what I would like, without any real means of developing that and making that happen. And what we try to do is, look, here's something we know. We know that most of the time when people tell us why they don't work out, they blame it on things that are external, and they don't want to admit to themselves or to you and me that they just don't like it, right? Like they just don't like it. And sometimes we put that on people. We tell people that according to the American College of Sports Medicine, we should be exercising 150 minutes a week. And when they look at that, they go, that's so unattainable for the majority of people that instead of doing a little bit of something, because they're looking at such a vast picture, they just say, what's the use in starting? What's the use in trying? How do you kind of take these individuals who have these big pictures, these real outcomes that they want, but they just don't have any desire to get there?
Yeah, and again, we're reframing the conversation. So we're not even talking about, that's not even part of the conversation yet. We're starting with what's important to you, because they're there, right? So they're there for a reason. And so we're saying we're going to start with you. And that kind of mind shift not only builds trust and rapport with the person right away, and so that they're more likely to then ease into these ideas of exercising more regularly, but it's starting with them. And by acknowledging what's important to them, you're more likely to get them then to follow along and adhere to a physical activity plan.
Okay, so it's really about giving them the space to express what they want.
Yeah, absolutely.
And so if you had somebody that came out and they said, Antoinette, I want to be healthier. I get winded when I go up the stairs and I'm tired. I need something different. I know something's off and I believe this is going to help me, but I don't like it. Where would you go with that?
Yeah, and I would say, I think people are afraid. I think you're afraid that I'm going to tell you have to do more than you think you're ready to do or capable of doing. Right. And that's it, right? We have to meet people where they're at. If we don't meet people where they're at, and that's the thing, it's that fear and that lack of confidence that holds people back and makes them drop out. Their fear of being judged, their fear they can't do it, and they're not confident they can do it. So I say, that's fine. What's our starting point? Is it 3 steps? What's going to get you to the next step level? So you tell me, what is you capable of and what are you confident that you can do? And let's start there. And then I build on that.
Okay. So here's one of the things that I like, and it's a wonderful coaching technique that really relies on you letting them guide what they can do as opposed to you telling them what they should do. And I used to train a comedian, and she would say, don't should on me. So she just didn't want anybody to tell her what she should do. And it was important to me to hear that, because then I could go, you know what? Rather than me telling you what you should do, what I should do is rather ask what you can do. What are you willing to do, and let them guide it. And one of the things that the educational programming that we did in school talked about this type of education, and the education about teaching and andragogy was in part allowing your students to help identify what problem they're trying to solve, and allowing them be a part of the problem solving. And what we as trainers want to do real often is hold all the answers and be the harbinger of everything fitness, and not allow people to bring things to the table. And we should probably back off on the dictates and start to encourage people to participate in their own kind of I'm going to say self-guidance. I think that's fair. Like, let's give a little self-guidance, allow them to create this self-guidance, and for us to be there as counsel to see what it is that they're doing. Do you feel like that's got a hold?
Yeah, no, that's exactly what motivational interviewing is, which has been shown to be extremely successful in creating behavior change. I mean, the fact is that knowledge, people know a lot of times that they need to be healthier. They know that there's exercise guidelines. They might not know the specifics of, but they know they need to exercise. It's not a knowledge gap. It's a motivation confidence gap.
That's very true. Yeah. It's kind of like anything, right? Like stopping smoking, or exercise, taking your medications,
eating healthy. Yeah.
It's not that you don't know it.
Yeah.
It's that you oftentimes don't want to do it.
It takes a lot.
It does. So giving the space for people to engage in that, and also giving people the freedom to just say, I don't like it. Right? Because I got to be honest, my workouts, I oftentimes don't like them. Right?
Sure.
Like working out sometimes just isn't there for me. Like, it's not what I want to do. It's not where I want to be, but there is a motivation. Oh, this is something that I was going to ask you about. So there's some confusion sometimes when people talk about intrinsic and extrinsic motivation. And so a little clarity from you with this is, right, like, if you walk by and see those shoes that we set by the door, is that an extrinsic motivator, or is that simply a reminder to do something?
That's a reminder. Extrinsic motivator is more like, I'm going to buy myself, give myself this reward, again, a reward for doing the activity. So at the end of the week, if I do all my running, I'm going to buy myself a new pair of running shoes, which is fine. You can have extrinsic rewards, but they should then build into me being intrinsically motivated to continue the behavior. So extrinsic rewards and motivators are good for starting the behavior, but then it has to become part of my value system in order for me to continue the behavior. I think that's the key nuance. Yeah.
Okay. So this is important too, because there are apps out there now. And you do these apps and they give you badges and rewards and things like that. And I'm like, yes, I got another one. You know what I mean? So there's something enjoyable about that.
Sure. But I think they wear off. Their novelty wears off over time, but some people love them, and that's great. But I think after a while, we kind of just be like, oh, here's another one, and it wears off over time. Something else I wanted to bring up that you keep bringing up is this idea of a relapse, and in the sense that, there are days that I don't feel like exercising either. And I think people have this all or nothing perspective, is like, I have to do it all the time, or I'm just going to give up, and that's it. And I think we have to normalize that it's okay to slip up. It's okay not to exercise, not want to exercise every day and be totally enthusiastic about it all the time. We're human beings. Things come up in life, like you said, things are out of control. So we have to normalize the fact that we're going to slip up. The key thing is that we have to have a plan for when that happens. You have a day where a week, for example, that you just don't exercise. Okay, that's fine. How are you going to get back on track once kind of you get through that slip, and normalizing that process?
Yeah, I do that sometimes. I'm diabetic, so I'm type 2 diabetic, and I was just out of town with family, and the food was a little bit more. Shouldn't have been there. All right, so no, I should have been with the family, but the food was there. My daughter had her birthday, so there was cake involved, ice cream cake, by the way, so it was extra into that. And then when we left, and I wasn't exercising very much. And when we left, I had taken my blood sugar and it was incredibly high. Well, I don't know if that was a reminder or an extrinsic motivator. I do know that it was about 11 o'clock at night and I was like, I have to go for a run. I have to get these numbers down. I believe that there are some people who see things like that in this world, but I get immediate results, right? Like I can go for a run, and when I come back, I can test my blood sugar again, and I'm like, boom, there it is.
Yeah.
Weight loss is different, or building muscle is different. It's not a reward like that.
Yeah. Well, that's again why we have to focus on a process and not an outcome. Because if we're always focused on outcome, particularly for weight, which could change from on a day-to-day basis, we'll be discouraged. And so there has to be something else we're aiming for in order to kind of stay motivated.
Yeah, I'm with you about the process and also about creating change. I know my lifestyle, once that diagnosis for me happened, it was really challenging for me to switch some things around, and it took a lot of time for me to shift in a meaningful way that I thought created value in my ability to stay intrinsically motivated. Like I want to exercise. If my numbers are high, I actually want to go for a run. Like I don't look at it and be like, oh, like there are things that just, they stimulate me to do something, but it's something I'm already ready, willing, and able to do.
Yep. Yeah. And there's an activity that I do with patients of rating their readiness, willingness, and ability to do things. So on a scale of 0 to 10, how ready are you to make this change? Or on a scale of 0 to 10, how confident are you? Because if they're giving me low ratings, we need to do some work before we can enact the plan. It's no sense of setting someone up for failure. So if they're saying to you, I just made this goal, but I'm a 3 on the goal, you don't send them on their way and say, see you next session. You rework it until you can get them to an 8 or above. Don't set people up for failure.
Now, one of the interesting things from what I understand with motivational interviewing, and you know more about this than me, but I found this interesting, is that when somebody provides a low number like that, instead of asking them, why is that number so low? Let's say that they did say a 3 out of 10. Instead of saying, why is that number so low? Asking them why they ranked it as high as they did. Why is that a 3? Why would you give yourself a 3 and not a 2 or a 1? What's the thought process behind that?
Yeah, no, that's absolutely correct. So that then gets people talking about the reasons why they can do it, and maybe then that incites more confidence in them. So they say, you know what, I'm not a 2 because I've done it before, and I know that at least on some days I am able to do this. But we never ask them why not a higher number. We used to do that. We don't do it anymore. So you wouldn't say why not a 5 instead of a 3, because then they're going to start talking about barriers. So you always say why not a lower number, because they start then self-talking and talking about the reasons they can do it.
I love this concept, right? It's focus on what they can do. It's focus on what they can control. And the worst thing that you can do is find yourself in a situation that's stable, which is you kind of can't get out of it. Like diabetes or heart disease, or, like this is a current stable situation, and it seems like it's out of your control. And when you put those two things together, it is kind of a great combination of absolute paralysis. And what you have to do is give people back some control, and let them know that if you focus on what you can do versus focusing on what you can't do, you'll actually do.
Yeah, no, that's absolutely right. And I think, people get lost in the kind of all the behavior change techniques and don't know where to
Sure.
start. So I always recommend the rulers, the 0 to 10 for ready, willing, and able, as a quick way to really get a pulse of where your person is and where to start. Because again, if their readiness is low, you don't want to go into all the things they can do. You really need to kind of do some work again to build a relationship with them. You really need to be on the same level.
I love that. And one of the other things about the process, focusing on the process and not the outcome. Because here's the bottom line. You can't get to the outcome unless the process happens.
Right.
So if all you do is stress about the outcome and not focus on the process, you're not going to get very far very fast. And then you'll oftentimes get disappointed because you keep not getting there every time you go to the gym, every time you show up. And really what happens is that when you provide people a delicate balance of something that's not too hard, but hard enough, right? So it's got to be not too difficult, but it's got to be difficult enough, because if it's not too difficult, they'll look at it and be like, what's that going to do though?
Right.
And then if it's too difficult, they'll look at it and be like, there's no way that that's happening. Do you have any kind of techniques on, or is it just kind of explore it and see what works and see what people are, again, willing to do, these kind of...
That's right. Yeah, it's really getting to know what their baseline is and what they're currently doing, and then what their goals are, and then kind of finding meeting in the middle from there. But making sure you always know the baseline. I think that's very important, and kind of gauging what's the not too much but too good enough.
Well, I tell people oftentimes that the anticipation of the gym is worse than the gym itself.
It's very true. It's very true.
And so a lot of times, just a technique that I'll give people is, I'll tell them to pick their favorite exercise, and whether that's, let's say, bench press. They're going to bench press. I go to the gym and do one set of bench press, and then you've won for the day. Like that's all I'm going to request. And they're like, what's that going to do? And of course, that's giving too little. But what I do initially is I say, just give yourself your permission to go and do one set. Now, if you want to do more, go do more. But as long as you get that one set in, and we have a 3-day period, you've got 3 days to go once and make that happen. They're usually pretty good at doing it, but very often they say, while I was there, I went ahead, I did like 3 sets, and then I walked on the treadmill for 15 minutes.
Yeah. No, that's right. They say that's the thing. Again, you're breaking it down, right? You're not making it overwhelming that you have to do this whole plan. That even same with like running, just, try 3 steps, try 5 steps, and then it just kind of catches on. But let them feel that, that feeling of catching on, rather than you telling them you have to accomplish all these things. They're naturally doing it themselves. Again, that intrinsic drive.
Oh, that's fantastic. Well, look, we're getting close to our time, because I know that you have a hard 45-minute stop. Yeah. And I just want to reach out to Greg and ask Greg, since we've been on the Facebook Live, if there's anybody in the chat that has asked a question that they would like to Antoinette to answer. Oh.
Again, the mute button always gets me, Rick. I apologize about that. So yeah, there was actually a very active chat today, but Ada kind of wanted to know, and I'll paraphrase this because it's kind of long, but how do you determine the fine line between a client making excuses and understanding when a client has a legitimate problem, so you're not trying to push them too hard? I think is kind of the general what he's looking at.
Yeah, that's a great question, right? So you can have someone who's feeding you a lot of excuses. And again, first starting with a relationship, knowing your client well is really key. You never want to accuse a client of saying they can't do it when they really can. And I think, again, it's really starting with that 0 to 10 scale, understanding how ready, willing, and able, and laying out their values, and having them say to you, and just keep tying it back. You've said to me that this is really important to you. I just want to make sure we're on the same page so that we're doing the right thing for you. Never take a blaming, to always take a non-judgmental approach, normalizing the behavior, things like that. And people will be much more likely to be honest with you.
Oh, I love that. Thank you. And normalizing it is important too, because I think even people look at us as personal trainers and they think we don't get it. I look at some other personal trainers and I think they don't get it. Like I'm like, I don't want to exercise, and they're there every day and they're doing their workouts. It feels like they don't get it. So allowing ourselves to say, look, it's not every day. It's not what people necessarily love doing until they develop the process to make that happen. And even when that happens, it's not that you love doing it. It's just what you do. It's habit. It's very Zen. It's kind of like, why do frogs jump? Right? Because they're frogs. And you just look at it and say, this is what we do, because at this point it's so internalized. It's part of the identity of who I am and what I commit to.
Yeah. And people are more likely to give excuses when they feel they're going to be judged. And so if you're right away normalizing and taking away that feeling of judgment, then they're less likely to give you any kind of excuses. So again, saying, you know what, there are some days that we don't want to do this. I have days where I don't want to do this. So, and just level set with them, and they're more likely to be honest.
Thank you. Greg, we got anything else? Oh, mute.
Julie wants to know what is the... Again, the mute button. Julie wants to know what is the key. Sometimes people feel their motivation is one thing, but it really isn't that. What's the key to getting to what their true motivation is?
Yeah, and again, it's starting with their value system. So you're right. A lot of people want to lose weight, and that they think that that's what's in it for them, and looking good in a bathing suit, or whatever it might be. But oftentimes that's very superficial, and it has to be something more about quality of life, healthier life, things like that are more stable than things that are more extrinsic, like bathing suits, etc.
Nice. What else, Greg? We got him. Keep him rolling if you got him.
We got to
answer as many as we can while Antoinette's still here.
That actually is the end of what came up in the chat. A lot of people agreeing with your talk, and thank you guys for this. I found it very valuable. But that was the primary questions that we had in the chat today.
Thank you.
Excellent. I did too. And just to go back to the last person's question too, is that a lot of times people give these excuses, and excuses are usually external excuses as to why they can't do something. So, and that's kind of built into us, right? Like, I'm a big college football fan, and my team is Alabama, and Roll Tide 100%. But when Alabama loses, then I go on these rants like, why did they do this? And then that guy dropped the ball, and then this guy did this, this, and then Saban just didn't have it together today. And then suddenly they win, and my vocabulary completely changes from what they did and what they did and what he did to we won. We did it. And I'm hugging people who all think that they did it too, right? So we identify with different people and different things. And I think a big part of what we do is that we'll put blame, we'll put things out in order to protect ourselves. And that's what that does, is that we want to protect ourselves. And I think in one of the things that, Annette, that you're talking about is allowing people to have the space where their ego isn't challenged when something is difficult to accomplish.
That's right. That's right.
Good. That's what I wanted to get to. I think that's a pretty decent place to wrap up. Annette, do you have a website or social media or anything that you want to direct any of our listeners to that they can follow?
Yeah, I mean, you can go to the Center for Healthful Behavior Change. It's CHBC. It's at NYU's website. It has all more information about this, and then has my contact information if anybody has more interest in it as well.
Amazing. Thank you so much, Antoinette. I thank you for being on the show. Thank you for being a part of it. For those of you out there listening, thank you for listening. If you have questions or a particular topic or a concept that we should get a subject matter expert for, like Annette was for us today, then please reach out to me at rick.richey, RICHEY, at NASM.org, and we'll see if we can get that taken care of. Thank you so much for listening. This is the NASM CPT Podcast.